Hi everyone, Dr. Demito here. Um, I'm going to speak today on a topic that is going to be of great importance when you write your final paper. This is going to speak to neighborhood and population assessment. So, a lot of the information in the recording today you're going to find very useful as you put your paper together. Um, and that's what we're gearing up this whole term. Each week we're gaining more information so that you can have what you need to develop a good end of the course paper. I'm going to put together a review of APA so that you can have a great understanding because APA is very important when you're writing graduate level papers. It is a way to express your level of professionalism. So people may say, I'm going to go into leadership or I'm going to follow the clinical path. And that's wonderful. But as you are making those steps towards the end of your journey, it's important to ensure that you know what needs to be um, done to reflect your level of professionalism in the field of graduate level nursing or doctorate level nursing for that matter. Okay, so I'm going to turn off my video and move forward with our presentation on neighborhood and population assessment. Okay, neighborhood and population assessment. What does this mean? This means that place matters. It means that oh, the locality of your population matters. I see this as a working nurse practitioner. I am afloat with an urgent care system and I go all over the place. So I may be at Melrose Park. I may be in Lakeview. I may be in Mayfair or Elmhurst, for that matter, or Wheaton, Carroll Stream. Each one of the neighborhoods that I am at is a culture, right? They have their different ethnicities and different distinctions, and I find it fascinating that each one of these little neighborhoods can be so different and so diverse. And you're going to find that with your final assignment and bring that all together. And it really helps guide us as advanced practice nurses. It helps to guide us to ensure that we are meeting the needs of all of our people and that there is no one specific um, treatment that fits everybody. So one size does not fit all in healthcare. All right. So we're going to be looking at community. And for this class, you're going to be looking at one of the 77 different Chicago area communities. And some of the communities seem to have less common culture value norms than others. So if you choose a community that is gentrifying or experiencing rapid shifts in age or ethnic groups, that might be a good thing. All right. So, how do you define a community? And here's the definition: a group of people often living in a defined geographical area. They can share common culture, values, norms, are arranged in a social structure according to relationships which the community has developed over a period of time. Now, I have found that you can have different cultures in a community, right? I have found that. They don't have to all be similar. They can have some similarities, but you can have some different cultures within the community. And members of a community who gain their personal and social identity by sharing common beliefs, values, and norms which may have been developed by the community in the past or modified by the future. And this definition comes from the World Health Organization. And remember, I really, really like using resources and references that are legitimate, like World Health Organization, CDC, and any of the governmental agencies that um, are involved in statistical data and research. All right. So when we deal with an individual or a family as a healthcare professional, we can't separate them from their community. We need to incorporate their belief systems into the care that we provide. And so in order for them to uh, achieve that membership in a community, um, they need to, as I said before, we need to incorporate that community into the healthcare that they receive. Community is a patient. So population health and community health, the course that you're in now, the focus of this is the collection or common goods of the population instead of the health of individuals. So population health is called population health because we're looking at populations, not individuals. It focuses on um, different levels of community. And the population focused nurse can work with individuals, families, or other interacting groups, aggregates, or institutions within a population, but the resulting changes are intended to affect the whole as a community. So you may actually begin with an individual, and then that will then um, grow and develop and reach outward so that it is reaching the community. Who is in this population? And this is all information you're going to need to gather for your final paper. Demographic data, age, what race and languages are spoken, gender, socioeconomic status, education, employment, unemployment, income and poverty levels. And you can gather some of this data through observation and through interview, doing a windshield survey. What does that mean? I can remember when I did this. I did this when I was getting my BSN. We were required to do a windshield survey. It was huge. Um, it was a huge project. And I remember thinking to myself, this is a master's level assignment, not a bachelor's level assignment, and this is kind of validating me. But you get in your car and you drive North Park University, and I decided to take a different way. And it transversed me through a community. And it was so interesting to see the apartments and the children outside and I live in the northwest suburbs, so the city of Chicago is foreign to me, and I greatly enjoy the observation of reviewing the neighborhoods. I am fascinated by the use of the city of Chicago um, bikes and scooters. In fact, my grandson just told me the other day that he and his friends come down here all the time. He went to University of Chicago. He just graduated, and they take the L up here and get scooters and drive all over the city. So those are some of the things. Maybe you could do a windshield survey by on one of those scooters. That might be a great idea. Community Commons. So this is a great site that you can go to, observe the tools, data, and reports that are there. There are stories and um, enrich the site by sharing your own community data. You can certainly do that on communitycommons.org. So if you go to this website, you can look at the maps and data, browse for things of interest, and then start going through the channels one by one. You're going to see economy, education, environment, equity, health, transportation, and housing. There's a great deal of information in in this website, and it's been submitted by the users of the website. So you can revisit the website as you're writing your paper and have chosen topics that may be making your community more vulnerable or have strengthened its ability to be resilient. So there are a number of stories that you can click on and view the City Health Dashboard for Chicago, Illinois. Very interesting. Okay, so what health issues impact the population? This is a question you're going to ask as you look at the population statistics data. You'll be asked to identify 3 of the most troubling health or health-related concerns you have for residents in that community, and then choose one to focus on for your paper. So, some of the health issues that may impact your population: morbidity, communicable disease, non-communicable disease, mortality, risk factors, what's the rate of obesity, smoking, drinking, birth statistics, infant mortality, teen pregnancy, receiving prenatal care in the first trimester, and other factors like violence or unintentional injury. All right, so this slide's a little on the old side, but as I had stated in previous presentations, it's not always easy to obtain super recent data in healthcare. As soon as healthcare is published, it's outdated, it seems. So I'm looking for a slide that is more relevant, because this is all the way back to 2008. But obesity is a good place to start, since it seems that obesity affects almost any community in the Chicago area. So if obesity was either the primary problem or a contributing problem, then you would want to see if there's a relationship between the prevalence of obesity, gender, ethnicity, and income, like you see on this slide. So consider how to interpret income. Example: multiple poverty level by multiply the poverty level by 3.5 and determine what residents live below this income level. Contrast with poverty level multiplied by only 1.3 and consider those who live below that level. So do you have a high prevalence of poverty in the neighborhood or the community that you've chosen to evaluate? All right, so this is a seminal foundation to the topic of contributing factors to the health of an individual, family, or community. So keep these percentages in mind: 40 socioeconomic, 30 health behaviors, and 20 clinical care, and 10 physical environment. So this does discourage you who are working so hard in a clinical care environment. Does it highlight the importance of health policy, advocacy, and compassion? So these are all relevant factors on health. So there are some we have control over and some we don't have control over. But look at the huge impact of these things: 40% socioeconomic factors, 20% clinical care, 30% health behaviors, and 10% physical environment. Well, we certainly have the ability to help impact health behaviors, right? That's a big factor, 30%. Clinical care. We need to ensure that we are aware of the healthcare facilities out there that are available and accessible to our community. Socioeconomic factors are something that we have much less control over, and physical environment as well. So those, we have 50% that we have very limited um, ability to adapt, or not adapt, but to help our patients with. And that, yeah, we have 50% that we can assist with, right? Half and half. All right. So let's look at this. Who serves the population? Um, all the community resources of potential partners, and we can find a lot of information. Look at the Healthy People 2030 site, access that community health website, look at Cook County Department of Health. Oh my gosh, you can get so much information through that. Local hospital, community hospitals, needs assessments at hospitals near your chosen community, and we're going to talk about that later on in our presentation. But when you're looking for community resources, you're going to look at healthcare options, neighborhood organizations, social service agencies, faith communities, employers, businesses, and national organizations. Your community may have a plethora of local resources. I find one of the issues with patients is that the resources are there, they just are unaware of them. So, as healthcare providers and as leaders in the community, it's important for us to have a high level of understanding of the resources that are available to our patient population, because they may have the resources, they're just not accessing them because they don't know about them. All right. So a community assessment, and we need to know what kind of data is collected for a community assessment and what are the steps, because this is going to be very important for that paper. Assessment data has to be systematically collected, organized, and placed in assessment categories, and like demographic, general health, specific health concerns, environmental, and both physical and social. So it's important as you are collecting the information for your upcoming paper, which is going to be due the last day of class, you need to ensure that you're collecting and interpreting this data, and the data generation. Data collection by the writer isn't required for this course, so you're not going to be creating the data. You're going to be obtaining already developed data through informant interviews, focus groups, participation, observation, windshield survey. And the collection of reported data is a secondary analysis, and this data is going to be collected by someone else. So this is the data you're finding through Cook County Vital Statistics and sources such as that. All right, so here we go again. Assessment of health determinants. You're going to do this potentially through your windshield survey. Consider a learning walk and walk through the community. It's not required, but it can give you an idea of what the community resources have. And I like to do this too. What do you see in the environment? Are there green spaces, parks? Just by looking, what is your thought about age, race, gender? Is there evidence of poverty? Do you see resources? What opportunities for healthy choices do you see? What potential problems do you see um, as you're walking through the community? And this gives you more points to consider in your community assessment. So if you wanted to develop relationships with folks in this community, where might you hang out? Are there church groups? Is there a community center? What about a park district? Do you observe any specific, or are there any observations about people in the community considering age, ethnicity, behavior? Do you observe about the physical environment? Are there green spaces, parks, pools? What resources stand out? What are signs of health and hope? Are there possible stresses, hurts, or needs that stand out? And what was your overall impression? What opportunities and challenges for health do you see as you walk through this community? So as you can see, this paper is dependent on the acquisition of a great deal of data that you are going to put in, both statistical data that you are going to obtain about your community, but also what you see. Neighborhood resources and stressors could include ability to access food. Does your community have supermarkets, or are they food islands? What about education? Access to education and transportation, housing, business and development, with social support, health, public safety, green spaces, recreation, and religion. All of these factors are things that you're going to consider as you're doing your research. And you we recommend you doing a windshield survey, but now with the internet and all the resources that are available, you can certainly gain the majority of this information on the internet. So let's get started. Gather demographic data on your community area. Gather health data on selected public health indicators specific to your community area. And as you identify a population health problem of interest in this community, search for the epidemiology. I want you to identify 3 leading health challenges in this community as it compares to the city of Chicago. So you're going to compare your community to the city of Chicago as a whole. So the city of Chicago must be included in the health profile, and comparison to national data is required for your final paper. What groups are most at risk for these problems? For example, this might be a group defined by age, income, race, gender. So this assignment requires you to choose one subpopulation. For example, the Asian Americans living in Albany Park. That's the community around North Park University. Or elders over 75 living in Jefferson Park. That'll be the population that you focus on for this paper. When you do your literature review, you probably will not find journal articles that specifically address your subpopulation, so you're going to need to extrapolate based on what you know about the identifying characteristics of your subpopulation. For example, if you're studying the risk of lead poisoning, what do you know about teen mothers that puts them at risk during their pregnancy or their infants at risk? Do they usually have an adequate income? Where and how might their housing be affected? Do you think they have follow-up for proper prenatal care, or what about postnatal care? All important factors that I want you to consider. So I know that your mind is just totally garbled at this point, right? There's so much information that you're thinking this paper is going to be a nightmare. And no, I don't work like that. We're going to do it in pieces. Remember, I'm a small test to change person. So we're going to work on this paper in little itty bitty pieces. And then at the end, you're going to put all of that together and you're going to make one big, beautiful paper as a group. So you're going to have a partner, at least a partner, to work on the end of this development of this paper. Now remember, we have an odd number in this section, so one person will have one more partner. However, the expectations of that group will be a little bit higher because they have an extra partner, right? So, and that is for this cohort. If this is being seen by someone not in this cohort, perhaps you will not have an extra person in your group. So, I am making this presentation for the course as a whole, not for just our specific cohort. All right, so let's look at these challenges, examples of 3 leading health challenges. And these challenges are written in a particular template form. So you're going to write statement of health concern followed by due to or caused by, and those are contributing factors that you identified in your data search. So pay attention to these examples of how to write a community diagnosis. It must be included in your paper. Where you put it in your paper is your choice. So let's look at these examples of the 3 leading health challenges. Potential risks of continued high rates of childhood obesity, especially those in the Hispanic community due to small amount of outdoor land for activity and low utilization of prevention because of decreased rates of health insurance coverage. So that's a good way to phrase it, right? An increased risk of diabetes. Slides, we're going to talk about the possible considerations to use in the defense of why you choose your particular health concern for the remainder of your paper. So in the health profile, be certain to develop this rationale fully and back it up with data. So we need to determine the greatest priority, right? So consider ranking public health concern in terms of chronic disease burden or resource drain. Community or population concerns. It's best to work with key organizations and members of the targeted community or population to see what they're concerned about. alignment with the city, state, and national priorities, and consider what is most feasible or what will have the greatest impact. What priority health issues are you finding in your community data? So lots of information that you're going to be obtaining. So remember, you're going to need to defend your choice of problem, and you're focusing on the rest of your paper from the other 2 or 3 health related concerns that you identified. For example, so you notice that the community has a high prevalence of tuberculosis and heart disease. But you're going to focus your paper on teen births. Now, why would you choose that focus? Was it because it seemed like the community already had some programs in place for working with young teens in the school system, and you think perhaps it's both feasible and there will be strong return on investment to come along the side of these existing programs? So remember, you want to focus on the area of greatest concern. If you choose not to, you need to defend why. You need to prioritize the issues, cost and or return on investment, the availability of solutions, the impact of problems, availability of resources, urgency of solving the problem, and size of the problem. For example, the number of individuals affected. So here are some of the resources we're going to start showing you, and these may be of value. Each of these links have been checked, but remember, websites change frequently. So if you go and there isn't any data there, they may have changed their website. But these are really good websites to get some data from to help guide you with your paper. Now, here we have County Health Rankings Model, and the rankings are based on a model of population health that emphasizes the many factors that, if improved, can help make communities healthier places to live, learn, work, and play. So this slide illustrates how the rankings were determined. So go to the active link and compare counties in Illinois. Notice that this information is for suburbs and communities outside of the city of Chicago, but within Cook County. And you can type in Chicago and type in the zip code of the community that you're researching. When you really want to drill down on data, it's very, very good to use the zip codes. I used to be on the Illinois Department of Public Health, maternal fetal medicine, morbidity and mortality committee, and we did all of our work by zip code, identified all of the factors, and it was really fascinating to see the differences in zip code. Huge difference. All right. Here's another resource for you, Community Health Navigator. This is going to help you know what affects health. It's the what, where, who, and how, um, including a focus on the greatest need, collaborate with others to maximize efforts, and the 4 action areas of socioeconomic factors, physical, environment, health behaviors, and clinical care. We saw that slide earlier, and here's the site that you can get to it. This is through CDC. I love CDC. We've seen this slide before too. It's that circle. 5210 get started, and there's a YouTube video here that you can go look on, that will illustrate this a little bit more, and what can actively help community members gain a greater understanding of what they need to do to improve their health care. All right. Here's another website for you. You can follow this website to gain more information about public health infrastructure. Some really good sites here. All right, next one. Academic research and community partners join to develop models and approaches to building communication trust, and capacity, with the final goal of increasing community participation in the research process. It's an approach to research which equitably involves all partners in the research process and recognizes the unique strengths of that each brings. And not only that, I think I told you I used to be the director of nursing of a large department of women and infant services. I had 160 staff. And incorporating change in such a huge department was what a challenge, because we had great diversity in our employees, between veterans that had been there for 25, 30 years and those who I hired new grads. They all had a different uh, thought process regarding change. So I adopted the shared governance form of government in my management style and actively engaged the employees in the implementation and the development of process change. So if you bring your patients on board and actually use that shared um, partnership model, they will more likely follow the process because they've been an active participant in the development of their goals and what they need to implement to achieve that goal. All right, here are some examples of CBPRs, which are community-based participatory research, Community Health Advisor Program, Cottage Community Care Project, Healthy Eating and Exercising to Reduce Diabetes. And so I would definitely go into all of these areas. Physical activity and neighborhood resources and high school girls study. So lots of resources you can get out there. And with Google now and ChatGPT, you should have no problem finding data. All right, so we're going on to a little bit of a different topic, the role of the hospital, where population health is concerned. All right, so what is it meant by managing the health of a population? So the definition and processes of population health management. This population health can provide a basis for improving health outcomes in groups through studying the distribution of health status and outcomes in a population and determining factors contributing to the present outcomes, identifying interventions that may modify these factors and change outcomes. So the role of those in public health, be it nurses or leadership, uh, of the utmost importance. They are the ones who are really identifying the processes that need to be changed. The people who work in the Department of Public Health are the ones that go out there and identify what needs to be done, and they're the ones who actually go in and develop the process and implement the process. They have a huge job to do. So, population health, they say it's a new buzzword, but it really isn't. It was just called public health before. So, the fact that we call it population health now, I really don't think it's new. It may be new for hospitals because hospitals are recognizing how these forces affect the health care of the patients that come to their facilities. We have an aging population. The baby boomers are all getting older, all in their 70s. We have a much greater diversity in our population. Life expectancy is really expanding, and the desire for patients to remain at home for treatment. Increasing number of insured individuals, but there is a huge gap in physician supply and demand, especially in the family practice arena. And that role is actually being filled by family nurse practitioners. So, more forces are driving population health. So, if you're considering a career shift, you may want to check this link for nurse employment opportunities. And it is https:// www.nurse.com blog. And you're going to see that there's a great opportunity for nurses today in public health and population health management, if that's something that you're interested in. Now, here's some more forces that drive population health. Performance forces like technologic advances. So many things are being done now. I mean, I had to have a sleep study done over the summer, and the equipment that they had for the at-home study, because my insurance wouldn't cover it in-house, uh, wasn't working. So they had this device. It was like a iWatch that I put on, and there was a thing I taped to my chest. Went to sleep, boom, done. It was amazing. So simple. Anybody, just about anybody could do that. And I was so impressed by the technologic advances. And my sleep apnea machine, it transmits all of the data to my physician and to the company that manages it. Emphasis on evidence-based care, including prevention and a shift to outpatient care. Change to value-based reimbursement and shared risk structures with payers. I'm glad to see that some physicians are, they're open to change. You know, I had my hip replaced in December, and typically that's outpatient. So you come in, day surgery, go back out. My physician, because of my sleep apnea and other issues, he kept me overnight, and I was grateful for that. Although the procedure itself was amazingly easy, I had very minimal pain. Um, and So I'm glad to see that physicians are open to that, because there are some patients where they need to have a night in the hospital. All right. So there are some links in your Canvas course that you're going to download that reference more societal factors, and a lot of these links you're going to find in Canvas that you can obtain. But managing population health, the role of the hospital, all of these things uh, can be are important, right? Food safety, health, food availability, genetics and poverty rates and care-seeking behaviors, pharmacy availability, big one. And transportation, that's another big, huge one, right? And you say, oh, well, there's Uber now. Yeah, that's great. There's Uber, but not everybody can afford an Uber, right? So, um, so many considerations in health, in population health. All right. So more partnerships between the hospitals and the public health partners, payers, other sites of care. Right now, there are a lot of standalone places that are not affiliated with hospitals that do things like MRIs and X-ray. And I utilize them in my urgent care for MRIs. And they bill insurance, but they also have a self-pay option. And their prices are a lot less than hospitals. Shockingly. One of those is called Brightspeed, so you may want to consider looking into that. Um, Other clinical providers and physicians. There are public health clinics out there, and some providers will work there because they get student loan forgiveness at these facilities, like Access, if you're not familiar with them. All right, so here's the framework for population health initiatives, and it's a circle. All right, so again, this goes more into the partnerships between public health and hospitals, the Southside Healthcare Collaborative, and the Greater Humboldt Park Community Diabetes Center. Collaborative initiatives between Camden, New Jersey and Cook County. And a community needs assessment. So let's talk just a second about a community health needs assessment and who does it, what's included, what's involved. And if you go to the Sinai Health System Community Needs Assessment, you'll be able to see what it talks about. And I'm going to post an example so that you can actually see what that health assessment looks like. So be on the lookout for that post. Here are some more sites that you can go to find some local data. Actually, I'm going to put the sites in here. They're not there. So there are not sites there. So some questions you may want to ask yourself as you begin to write your paper. What stands out to you when you look at the examples of successful population health initiatives involving hospitals? What do you see as opportunities and barriers for hospitals to engage in improving population health? And if you work for a hospital, how do you see population health principles from this reading being applied? So I want you to do your readings this week. And it's so important. This presentation is one of the ones I definitely think you need to see because it's really going to help guide you in what needs to be done at the end for your paper. So this week I'm going to put the rubric in. We're going to break in your reference sheet. They need to be done properly. So make sure that you're following APA guidelines. You need to use websites ending in gov, org, or edu. .coms, I do not want to see a .com website being used at all. I don't want to see Wikipedia used at all. You need to include your URL websites for your data and references in your website. And I will be randomly checking websites to ensure that they are valid and that they are appropriate websites. So don't worry, we're going to get through this. It seems overwhelming, but it really is not going to be. You're going to be just fine. And I want you to be aware that I really emphasize the structure of papers a great deal. So if you have your papers structured appropriately, you're going to be, that's the biggest part. Okay, so a well-written paper using appropriate APA and structured with appropriate headings, you're going to be good to go. All right, so any questions, I am always available to you. Reach out at any time.